Let's talk about Charles. You may have seen Charles sleeping in the park, asking for change on the sidewalk, opening the convenience store door, karate fighting an invisible opponent, surrounded by police. Charles has had 50 emergency room visits in the last year, 43 police encounters, 37 EMS transports, and more than 100 days in jail, just in 1 year. Charles lives in the bushes, in the park. I've had the privilege of working with people like Charles for the last 10 years. Here's the facts. 5% of our population utilizes 50% of the costs and resources in healthcare. Think about that. That's a stunning number, and it affects everyone in this room and everyone in our country. Whether it's employers trying to cover the cost of healthcare for their employees, the government shouldering the cost of Medicare and Medicaid, individuals trying to afford health insurance and healthcare costs have risen to over 17% of GDP. As a nurse, I've been working with the 5%, learning who they are, what are their stories, what really matters, and how can we change the system to improve their lives. When you see that number, you might be thinking, this has got to be, wow, a really big group of older people with lots of chronic diseases, and maybe people near the end of their life. But what I've been seeing over the last 10 years, there's definitely a very important group of older people in the 5%, but there's also some very important drivers that are having a bigger and bigger impact on everyone from 22-year-olds to 96-year-olds. One of those drivers is safe housing. If you did not have a safe place to live, and you were trying to manage diabetes, and you were couch surfing, where would you store your medications? If you had anxiety and depression, where would you go to feel safe if you had no home? If you had surgery, where would you find a clean place to recuperate? The second driver is behavioral health. In our country, less than 50% of the population with mental illness or addiction are accessing treatment. If you have anyone in your family with these issues, you know this path. What can happen is a felony record, which is followed by stigma, the inability to get employment, the inability to get housing, and that spreads costs all across our country in criminal justice and many other systems. But the first place it shows up is the safe harbor of the emergency room. The third driver is social isolation. I was working with an older gentleman who came over and over to the hospital. He had chest pain. We brought him into the ER. We gave him all kinds of expensive diagnostic tests, all kinds of procedures, inpatient admissions. We did the deluxe healthcare experience. Until I stopped to actually ask him his story, I had no idea his wife had died. He was coming to us with a broken heart. A simple question about someone's story can change the whole course, not only for the 5%, but all of us. The fourth complex driver is trauma. Research clearly shows the correlation between childhood trauma and adult complex illness, but I see a very different face of trauma. And this may not surprise you if you look in your own community. 40-year-old women coming to the ER over and over with unexplained abdominal pain, and the real root cause is domestic violence. Veterans returning with chronic pain over and over again, when the real root cause is PTSD. Understanding the 5% is like tapping into the canaries in the coal mine of our social issues today. Compared to other countries, the United States spends one of the smallest amount on social services, 4% of GDP. That lack of investment then shows up in healthcare, in criminal justice, and other places. So, one of the gifts of working with the population is seeing what makes a difference in that. Let's go back to Charles and his story. Charles had all 4 of those drivers. Not everybody in the 4% does, but Charles did. And Charles is a real person. He taught me a lot about what makes a difference. So the first thing that happened for Charles is his community, a police officer and a social worker, reached out directly to see if Charles would tell his story. Of course, the first time he said no. Who would believe this? They went back a couple of more times, and Charles started to tell what his life story was. For Charles, what happened is he had the experience of being seen and heard. This is a transformative moment for people in the 5%. Here's what he said. Charles had lived in the community for 25 years. He had a wife, a child. He had a successful business. He'd actually even been an Alcoholics Anonymous sponsor. Things fell apart in pieces, and he had several losses and went into a downward spiral, and one day found himself living under the bushes in the park. When they asked his story, they said, "What matters most to you?" What mattered most to Charles was getting well enough to meet his first grandchild. Being seen and heard is a two-way street. It's not only important for the people in the 5%, it's important for the people taking care of them. The police, the nurses, the doctors, the social workers, the paramedics, all of those folks are trying to solve social issues in a system that was designed to diagnose, treat, transport, and maybe even arrest. That's not why they all went into their professions. People want to do the right thing. And if you want to change the system and change care for the 5%, you also need to attend to those folks. What happened in Charles' community is they did just that. They looked around the community, and this is not a magical, perfect community where everyone gets along and it's a Disney song. There were old rifts in this community, some of the worst health outcomes in their state, some of those complex addiction and lack of resource issues. But that community looked around and said, who else is in this boat with me? The police, fire, EMS, social services, behavioral health, healthcare. And they sat around a table together and talked about being seen and heard amongst each other about what they were carrying and trying to solve. They created a collaborative called Project Restoration, where they worked on things as a community. They shared Charles' story together. They organized care around Charles' goals, what mattered most to him. Charles got addiction treatment and transitional housing, and most importantly, a sense of belonging. He was no longer alone. The same thing happened for the community. Belonging was critically important. As they sat at this table and stepped out of their silos, and they stopped competing for limited resources, and they actually walked outside of their buildings and worked together on a shared community problem, they had a sense of belonging with each other. This started to really change the game. The pivotal part for Charles came when he was in housing. The way they set up their housing unit is everyone who lives there is part of running it. Not only do they run it, once they're more stable, they become a mentor and a peer to the new people there. And then once they're stable enough, they join the collaborative, and they bring their voice to the table about what they think will change things for the community. This shifted to the third key principle for healing in the system and people with the 5%. Charles had a sense of connection, a sense of agency. He could make change, and he was part of we. The same thing happened for the community. They shared resources, they stopped competing for dollars, they got a lot done. They opened a transitional housing unit, they fixed the transportation system, they created an agency for co-located agencies. But most importantly, and the most valuable change that happened for them, is they also had a sense of connection, a sense of agency, a sense of we can change this. And they did. I can show hard numbers from that community, and I want you to know how much that it's bigger than just this community. The same approach is being taken in a range of environments, from rural California to urban Memphis. Some of the numbers from those programs are 82% reduction in criminal justice costs, 70% reduction in healthcare costs, 40% reduction in hospital visits. But the most valuable change is a return to dignity. A healthcare system reimagined around what matters most. And sure, there's policy and education and funding and regulatory changes we can make to make that happen, but the fastest way it will happen is if we turn to each other and ask, what matters most?